They say the key to good health is in your gut, but could your best health solution be in someone else's toilet? FMT, or fecal microbiota transplant, is a stool transplant procedure that transfers fecal bacteria and other microbes from a healthy individual to a sick one. And the outcome potentials for microbiome reboot have potential in more areas than you might imagine. My next guest is a gastroenterologist, researcher, and CEO of Progena Biome. Today, she's going to share her insight through her extensive clinical trial research to, well, talk shit. That's also the name of her book, by the way. We're going to cover the healthy potential, the behind the scenes of the research, and of course, the questions you all thought as soon as I said stool transplant. Seeking answers in overlooked places, asking the important questions, and shaking the beehive of Big Pharma, Dr. Sabine Hazen. Thanks for being here.
Thank you. Thank you for having me.
So I've heard that FMT has positive potential outcomes for just so many areas like Alzheimer's, autism, mental health disorders, obesity, Crohn's, celiacs. How is it possible that one thing could help so many problems?
Well, it's not one thing. It's really the microbiome, right? So the microbiome dictates who we are. And that's what we're finding out at Progena Biome is really seeing signature microbes that are linked to diseases, right? So a signature microbiome for anxiety, a signature microbiome for depression. So essentially, when you see all that, you kind of start saying, okay, well, there's a signature that I see that the person is anxious. Maybe if I take another signature of stools, I can convert the microbiome, right? And therefore transform the disease. That's the hope, at least. But we're really at the beginning of this.
And FMT is only FDA approved for C. diff treatment. I mean, you are like the most behind the scenes person I know in this space. Are we close to FDA approval for any other ailment?
No, unfortunately, the big challenge is the lack of reproducibility. When you look at cases like alopecia areata from Dr. Colleen Kelly, she had 2 cases that improved with fecal transplant and grew hair. But unfortunately, it was not reproduced. And this is where the science of the microbiome is really needed to do the research. And this is what we're attempting to do, is essentially look at the microbiome in alopecia areata, for example, and see, well, what is causing alopecia areata? What microbes are playing in that? And what microbes could possibly restore the hair growth, right? That's where the science needs to be. Unfortunately, with pharma, and I've been 30 years doing clinical trials with pharma, they like to push a product before asking questions, right? Because it's all about the price of that stock. So I think what we need to do is step back a little bit and say, wait a minute, we're heading into the microbiome, which is our shit, right? And we need to, rather than giving shit to patients, we need to start understanding it a little bit better. Because the microbiome that can change hair growth and in two alopecia areata can also cause hair loss in 2 patients for other conditions. And I've seen that, patients that went abroad and did fecal transplant and basically now have alopecia totalis. And nothing changed except for that fecal transplant. So one wonders, well, did they get the wrong donor that started an immune reaction and created them to lose hair? So we have to be very, very careful. These are trillions of microbes. We've barely identified 15,000. And out of those 15,000, maybe about 100, and I'm being generous, we know whether they're good or bad. The majority of them are good up to a certain level, bad up to a certain level. So it's really the wild, wild west out there.
I can't even imagine the challenge of trying to play matchmaker, like with all the different, what was it, Sesame Street? One of these things is not like the other, like that times a trillion. Is AI potentially going to have any sort of, play a role in that matchmaking process?
We use some form of AI up to a certain level. I will tell you, AI right now is a little bit flawed because it uses the technology, it uses the data that basically is not necessarily accurate. is one path, right? So in order for AI to work, you have to kind of remove the whole narrative of the other side, right? Because AI is going to be confused. Let's say I say a tomato is red, but I don't say the tomato's red, the tomato's slightly greenish, right? So if I have some data that says, well, the tomato's greenish, and then some other data that says the tomato's red, AI is not going to know. So you have to remove everything that says the tomato's green in order for AI to recognize that the tomato is red, right? So that's basically the same thing. If you feed AI some garbage in the land of feces, you could get a lot of confusion out there. And unfortunately, the microbiome space has so many flawed papers. So many. I would say 90% of the data. So remember, I'm asked to review all these papers all the time. I've kind of stopped doing it now because it's a waste of time, and the journals are a little bit on the corrupt side because they retract a lot of papers that should not be retracted. All data needs to stay, in my opinion, unless they're fraudulent, right? I mean, if a paper is fraudulent, then it shouldn't be there, okay? But if a paper is, has little mistakes here and there and doesn't really hurt anybody, keep it there. Why are you retracting it? Only reason they retract it is because it contradicts the narrative, which would confuse AI, right? Think of, saying one day a drug works and then the other day a drug doesn't work. But unfortunately, this is medicine and this is science. When we discovered digoxin, for example, for heart disease, it was the greatest drug. And then they said, nope, the digoxin is a dangerous drug for heart disease. That's science. Science evolves as you discover more things, as you do clinical research on the front line, etc. The other reason, and I'm going to be short on this, is that AI does not have the experience of a physician on the front line who's had 30 years of practice as a doctor, right? So it will read the data of, for example, Strongyloides, right, which is a bacteria, and say, well, Strongyloides is a parasite, blah, blah, blah. But it will not have experienced the one case where I saw Strongyloides in the lungs makes Strongyloides a lung problem rather than just an intestinal problem. So the experience of a physician on the front line is really, something you cannot replace. So much of medicine is an art, and so much of medicine is a gut feeling, maybe microbes telling us what to do. But you can't replace that. And, artificial intelligence is not going to have that gut feeling of how do I treat this patient? What innovations can I give that person, right?
Yeah, that's so interesting that you use the term gut feeling, but you're absolutely right. So outside of the approval process, which of the ailments on the research side do you feel most excited about, maybe just even personally? If you could, wave a magic wand and the methodology and the research and all everything just lined up, which ailment do you feel most passionate about as far as some of the potentials for FMT to help Alzheimer's and celiacs and Crohn's? Which ones kind of hits a button for you?
Well, I think Crohn's disease, it's not an easy endeavor. It's especially not an easy endeavor in a world that is bringing out products after products that potentially could kill the microbiome, right? So unfortunately, what we're seeing is a lack of good donors. And, already before the pandemic, the good donors were a problem. It was easier to get into Harvard Medical School than to, be accepted at one of those stool banks. But now after COVID, I feel like it's even more of a problem. And probably because COVID lit up the fact that a lot of people out there are having leaky gut and gut dysbiosis, and all appearing to be these healthy individuals and healthy influencers and athletes, but really all these people also have a lot of problems as well. So I think what the cover of the human being that appears healthy, when you look at their stools, it's not necessarily healthy. And so, that needs to be looked at. And so who are you going to use as a donor to save all these people? I think the most promising for me is really the idea of what feeds these microbes so that I can enhance them with feeding them the right herb, the right vitamin, the right bovine. We've done a study where we used Biome Booster Plus. They're called bovine immunoglobulins from cows that are, pretty clean. And we test the blood in our lab to make sure there's no Mycobacteria paratuberculosis, no spike protein, nothing, no viremia, no bacteria. And we gave that to patients, and we noticed that it increased their firmicutes, lowered the Bacteroides, lowered the proteobacteria. So for that person that has that signature microbiome of irritable bowel syndrome, that may be a good option for them, right? We have an amazing study right now where we're looking at a product, which is a natural product, a natural compound that was discovered to have an impact in possibly irritable bowel syndrome. So we've seen a signature microbiome with irritable bowel syndrome. Now we want to see if that product impacts the microbiome of irritable bowel syndrome. So we're excited because we only give patients a stool test, and then we give them this natural product and then see the effects before and after. We're also going to be doing a type of honey, so there's exciting research because we all have those questions, right? Is honey good for me? Is liver good for me? Is cumin good for me? Is apple cider vinegar good for me, right? It would be nice to kind of see, not changing anything in the experiment. In other words, people eat the same foods and then you just give them one thing that changes.
So in that case, would the bovine immunoglobulin be better than most pre and probiotics on the market right now? Because a lot of people have gut trouble right now, and even you did some clinical trials showing that the COVID virus was active in the stool, which, I don't know, does that explain long COVID symptoms? So we're all struggling a little bit. So to know that maybe this bovine thing works better than the pro and prebiotics at Walgreens would be a step in the right direction?
Well, that's definitely a step in the right direction. We showed that 16 out of 17 probiotics out there on the market don't even have bifidobacteria in there. And then the one that has it probably doesn't even reach the cecum. So a couple problems with the probiotics. Probiotics, you're supposed to mimic an anaerobic bacteria, a bacteria that doesn't breathe oxygen, right? So what happens when you're in a factory and you're exposing those microbes to oxygen? You've just killed them. So you're putting them in a capsule and the patient's really, eating dead bacteria. That's like sleeping with a bunch of corpses, right? So a live person sleeping with a bunch of corpses, that's not really a good idea. So I tend to think of it that way. Is the bacteria alive or dead? Secondly, is the bacteria in the capsule to begin with? So many companies just use the term probiotics and they just get in because there's no regulations. Nobody is checking these products, right? Nobody is taking that capsule and saying, oh, let me make sure that the label matches the capsule. Wouldn't you think that would be a good idea of our government to do rather than just looking at the papers? So they just randomly trust that the label is accurate. Well, wrong. The label is not accurate. And those are the studies that need to be done to make sure that this label says what it says, but also that the bacteria is alive. So no probiotics, in my opinion, should be over the counter unless they've been tested to make sure that there's a quality in there, that they're alive and they're doing what they're doing. The second thing is with the probiotics is a lot of them break in the stomach. So, the stomach acid kills them. They never reach where they're supposed to reach, right? Which is in the motherboard of the colon, in my opinion. And again, that's just my opinion from what I've seen of my research and my observations. This is a new science again, where we're discovering the power. So, we've noticed that bifidobacteria is present in newborns and absent in old people. So the aging process is really the loss of this bacteria. And that's how this whole industry of probiotics kind of exploded, $1 trillion industry of probiotics. Like that's the gold ticket, right? But if it doesn't reach the colon, if it doesn't act where it's supposed to act, you're really taking nothing. And a big question that I have is that probiotic mimicking or stopping you from growing your own innate probiotics? We're all different in our microbiome, but more importantly, we're different in our good bacteria. Some people are resilient. They lack bifidobacteria, but they have other microbes that are their microbes that make them who they are. So imagine you have bacteria X in your gut, And bacteria X is making you super focused or super resilient to viruses and bacteria. And then all of a sudden, I give you a bacteria that's a little bit weaker from someone else. That's going to suppress your own bacteria. And that's what people are noticing. People that tried probiotics were healthy, were resilient. And then all of a sudden, they get COVID. They ask themselves, well, maybe it's because that probiotic that was supposed to help me is not helping me, but it's actually hurting me.
This is the second time that you've said something to the effect of like the core of who we are is in our gut, which leads me to ask the question, for the people receiving these fecal transplants, have there been changes to their personality?
So there was a paper that showed that patients with C. diff who got stool donors were a little bit more anxious. And we published a paper that showed the signature microbiome of anxiety. So, yes, one wonders, is that signature microbiome present in that donor and therefore created anxiety in the recipients? As a doctor who performs fecal transplant, I've certainly seen my share of personality changes with microbiome, with fecal transplant. Usually I pick my donors, to be healthy, happy, non-suicidal, non-bipolar. So I'm very, very strict on my donors. So those donors essentially become the match for my recipient. I usually have the opposite. I have person is angry, bitter, and then we give them a new microbiome and they turn happy and much more at peace.
So where are you finding your donors? We talked about how it's difficult to find healthy individuals probably anywhere, but in the United States alone, only 12% of the public are metabolically healthy. Most of us have had COVID, so who knows, that virus could still be active in our stool, as you've seen in your research. Most of us take some sort of pharmaceutical, whether it be antidepressants or just birth control. I mean, who does that leave?
That leaves the people that don't follow the masses, and that leaves the people that are doing something completely different. So that leaves the population that doesn't listen necessarily to the media or the population that questions everything. So with that, I compare a lot of families. And there's always a neurotypical person in the family of a kid with autism. So I'm able to compare the two siblings, and I stumble upon what I believe is the healthy, normal microbiome. And I usually ask those people if they want to be donors. So it's kind of like a lottery ticket where you buy in to test your stools and then you stumble on, hey, guess what? You've got the golden poop. It's like the Willy Wonka golden ticket. I did a case of a kid with autism and using his sister's microbiome, who I felt was the better donor, not because she was neurotypical, but because of her microbiome. And when he started speaking using her microbiome, that's when I knew I was onto something. So,
was he non-speaking before?
He was nonverbal, aggressive, banging his head on the wall, 17-year-old kid. We submitted the case to the FDA because the only way to do fecal transplant in this country for non-C. diff is to work with the FDA. So I have a hard job because not only do I have to figure out the donor and play with poop and analyze, but also I have to deal with the FDA, which is a good thing and a bad thing. I mean, the FDA adds because they think of questions that I wouldn't have necessarily thought of. But at the same time, what we've seen with the pandemic is there was a lot of interference at the FDA level from external people that basically want a certain product to be pushed. So when we put a $sign on fecal material, I don't think we're going to ever get the answer, right? Because then you're biased and you're saying, oh, well, I could just sell feces in capsules and I'll make a lot of money. We need to really understand.
Yeah, and that is the tricky part, right? When we have this enough hope to think, okay, there could be answers, let's not give up, but we don't have enough pathway to do the thing safely, we become vulnerable to these people in Mexico who are, like I'm saying that specifically
100%.
Because there is a case of a naturopathic physician, I think he's Canadian, and he lost his license, and it was just like a whole thing. But actually that brings up another point that I wanted to ask you about regarding mental health, because I feel like if FMT becomes a positive outcome path for people with treatment-resistant mental health disorders, wouldn't that evidence trickle down into the mainstream in a very disruptive way? It would disrupt the entire framework of our, I don't want to say society because that sounds dramatic, but SSRIs, benzos, and even like nutrition recommendations would be turned completely upside down, which makes me think like, well, we're just never going to get that. Is that too dark?
I like to stay in the light, so I don't go into the darkness. You know, I've had multiple opportunities during the pandemic to go into the darkness. Remember, I'm the girl that challenged the narrative on early treatment, on, you know, asking questions about the thought of what they wanted us to do for preventing COVID. So I'm the girl that was asking questions. So there was a lot of darkness in those times, but I stayed positive and I saw the light. I think ultimately the microbiome is going to show the data. I think miracles after miracles we're going to see. Look, we have a case right now. 2 twins, identical, autistic, nonverbal as of July 2024. Their ATAC scores were through the roof. Basically, we treated them. We had a signature microbiome that we picked up in both twins, identical. I mean, you want to talk about validation, right? One stool sample shows this in one identical twin, and the other stool sample shows exact same thing. We corrected their microbiome, and basically the kids, it's been 7 months now, and the kids are verbal. Speaking, reading. Actually, the mom sent me a video yesterday of the kid saying her dad's phone number, one of the twins saying her dad's phone number. So when you see these cases of reversal of 2 twins identical, you have to pay attention to the microbiome and you have to push the science and you have to ask the questions. How come both of them were identical, nonverbal, and what happened to their microbiome that they got that way to begin with? Because then that could prevent the next kid from becoming autistic. And it's not a one thing causes, you know, I know everybody's, you know, going crazy with, you know, well, this is the reason, you know, the dyes and this. It's not a one thing, okay? Even the vaccines, it's not. I have some kids that are autistic and were never vaccinated. So, and I'm going to say it out there because I think there's a need for people to hear this. It's not a one thing. It's probably an accumulation of things. But we need to see what each thing does, because if you add salt to the wound, you're never going to heal the wound. So you have to constantly think of, how do I stop the killing and how do I restore? Because let me just tell you, it is not easy to restore. It was intense work from my lab, my coordinators, working with mom, and basically following every step of the way. And these genetic testing are not cheap. They're expensive because we go to the base of the microbiome. The whole process is about 2 weeks to process, 2 weeks, 4 weeks, up to 6 weeks to process a stool sample. So, you know, this is tedious work. I think the most important thing is not to interfere with the research.
So as we come up on time, I have a few like rapid fire questions. So the first rapid fire question is, what are the methods of transplantation?
There's a few methods. So for C. diff, we're going to talk about, because that's really what's defined in the literature. Pills that have been figured out how to get to the proper area and not break down in the stomach. The capsule that they used is actually pretty ingenious. So pill form, NG tube has been used, rectal for C. diff again, sigmoidoscopy via the sigmoid where we go only halfway, and then colonoscopy. That's the part that I like because I'm a gastroenterologist. I like reaching the cecum because the cecum moves backwards. So when you implant in the rectum, chances are you're going to lose those feces, right? Because you're evacuating. The colon has 3 shapes. So it has the cecum, transverse colon, sigmoid. And basically the cecum, the waves of motion go backwards. The transverse colon and the sigmoid, they move forward to allow evacuation, but the cecum leaves it. So I like to implant there because that's where it kind of sticks.
Are there any stool testing companies that you currently can recommend with confidence that the average person can use to just see where they're at?
So Progena Biome, which is my company, but it's a research genetic sequencing lab. So when you enter, you have to realize and you want to test your stools, you're going to sign an informed consent, because we're big on informed consent, where we basically are telling you this is a research test. We don't know the science of the microbiome is early. And basically, so you're entering, and then we're comparing you with, data that we already have in our database, but still at a research level. So we give you what we've learned so far, but it's still not something that's standardized or accredited by our governing bodies. I have to say, the National Institute of Standards does follow me, does follow my work. So, I think they believe we're standardized or validated. I'll tell you, when you look at a microbiome of a patient that you do fecal transplant and you've matched that patient to his sister, to me, that's validation, right? So we're in the world of the microbiome, we're really spearheading it. And that's probably because I am doing the research and because I am bold enough to try the treatment. You can't understand the microbiome unless you've achieved a cure. And you cannot achieve a cure unless you practice the art of medicine and innovate.
When the average person who's struggled with a cold or flu or something for, 10 days and it's just not going away, goes to urgent care and the clinician there prescribes an antibiotic, is there something else that might be effective that patient can advocate for themselves?
That's kind of a loaded question, so I'm not going to answer it, mainly because everybody's different, and I don't ever want to be between the doctor and the patient. And I don't want to trash my profession because I really believe they're handcuffed. We've seen it during COVID. These doctors are told what to do. Otherwise, they lose their license. They're supporting their families. That's all they know. They don't necessarily have the courage to step out of the guidelines because they're afraid. And fear is real. We have to acknowledge that we've made physicians fearful of lawsuits, fearful of everything. So I want to bring them to me to teach them rather than basically say, this is the way. So hopefully, as we get more doctors joining my path, joining us as physicians to learn about the microbiome, we have a biome squad. So we invite all doctors. So next time you go to the ER, tell your urgent care to join the Biome Squad.
Hand
so
them
he knows.
a
but
Biome Squad card. Here
but
go.
there's so many things, right? From nutrition to stress level to everything.
Last question. Where can people keep in touch with your research or donate to it if they'd like, and maybe even inquire about being one of your test cases? Maybe they have a loved one with an ailment that could, prove hopeful with an FMT.
So Progena Biome, Progenabiome, Progena Biome. So it's from your genes to your biome. That's why I named it that way, progenabiome.com. So they can send an email, say I have bipolar disorder, I have diabetes. Actually, we had a generous donor that basically donated 20 stool kits for type 1 diabetes. So we recruited within 2 days that study. The foundation is the Microbiome Research Foundation.org. When you go on the Progena Biome website, it'll link you to the foundation. It's a 501c3 nonprofit. We raise the funds and then we apply those funds to use for a study. That's how we achieve seeing those signature microbiomes, right? And then from there, once you see the signature, you could have a consortium of microbes and say, this is the solution to basically fix the problem, and then do early therapeutics or breakthrough therapeutics. So that's what I want to see in the future.
Awesome. Well, thank you so much. This has been fantastic. I'll link everything in the show notes.
Thank you so much.